will start with that topic of parental mental health. I'm joined by Heather Crampton, who is a licensed professional counselor. Heather, thank you so much for being here.
Thank you.
I love to be able to highlight any mental health topic, as I'm sure you may agree, something that's not talked about enough. So when it comes to, moms and dads specifically, we just had Mother's Day, Father's Day this weekend. In your experience, what are some of the mental challenges that can come along with being a parent?
Oh, a lot of them can come along with being a parent, but if I were to name a few, especially with younger children, a lot of times it's the frustration of having a child in the home. Kind of changes the dynamic in the family.
Yeah.
Especially if you're a full-time working mom, as well as a parent, and as well as a father, if you're a full-time working father, as well as a parent at home. There's a lot of challenges in that area, especially with the younger kids.
Yeah, absolutely. And, these are challenges that so many people face. As far as ways to, handle that mental load that comes with being a parent, that comes with, caring for little ones, what are some strategies that folks can be using, to, be feeling good mentally?
There's a lot. A lot of them are calming techniques. Whenever you feel frustrated, a good thing to do is to, do deep breathing. Give yourself a moment and kind of walk away. Even if your child is screaming, they're still safe. There's nothing that's going to happen to them. You can walk away and just give yourself a few moments. That way you're not responding to your child with anger or frustration, because that's not something we want to do.
Absolutely. And I guess too, on that aspect, how your relationship with your partner may be impacted as well by, that stress that kiddos can bring along.
Absolutely. There can be a lot of stress, especially when you bring in a newborn or a child into a family. You've been living, together as a husband and wife, and then you have this another, person in the house, and it can cause a lot of stress between the both of you. You can argue and fight who's going to change the diaper, who's going to do the next feeding, who's going to do the disciplining as the children get older.
Absolutely. And in your experience, are these some of the most common topics that you see, patients coming in to need a little bit more help about? Are there other topics as well, that are quite frequent?
Oh, yes. A lot of it is parenting. Some of it is work stress that comes in too. Mom and dad come home from work stressed out. It's hard to hang that, work hat up and then put on, the parent hat. So that can be distressing for people, and the anxiety and stress can get really high.
And, with all of that, a lot of this, is very normal, is very typical for people.
Right.
When it comes to strategies, like you mentioned, that you can do on your own, that's one thing. But when it comes to maybe you're wanting some additional outside help, when would you suggest that, talking to someone, outside of friends and family could be really useful?
Yeah, absolutely. When you're noticing that things are becoming distressing all of the time, you're starting to be irritable towards your child or your significant other or at work. Symptoms of burnout can be huge with that, feeling depressed, isolating yourself. That's when it's time to call somebody and say, hey, I need some help. I need somebody else to talk to.
And when it comes to that, I know some people love therapy and are all for therapy, but other people, there's a little bit of a stigma attached there, or they're nervous about, talking to a stranger. What do you tell someone who maybe has some of those feelings of apprehension about how helpful this can be depending on their circumstance?
Yes, typically when somebody comes in and it seems like they're a little bit anxious about being there, especially men tend to be a little more anxious. Not for any reason other than there's been a stigma on mental health and getting therapy, as well as men were taught, be tough, hold your feelings and don't talk to anybody.
Yeah.
So I'll explain to them, just like you would for going to the doctor for your physical health, why not go to somebody to talk to them about your mental health? Because your mental health and physical health are directly linked with each other. So if one's suffering, the other suffers as well.
Absolutely. And I think something else on that note is, you don't have to feel like life is spinning out of control or you've got this huge number of issues to deal with to speak with someone. It could be very, normal day-to-day things like parenting, like work burnout, things that so many of us experience. And maybe you just need, someone who's not so directly connected to you to kind of get that outside opinion.
Exactly. Somebody who can listen to you and hear what you're saying and kind of walk with you on that journey so you don't feel so alone. That's the main point. Is a lot of people feel alone and scared in what they're feeling. So it's nice to have somebody that can relate to them and can help them understand what they're feeling, and that what they're feeling is pretty normal for
Yeah.
most people.
Absolutely, absolutely. And when we're talking about moms and dads, ultimately getting that help, I'm sure, can enable you to be such a better parent or a
Yes.
better employee or a better partner. When you have that mental clarity and you're able to work through some of those issues you might be dealing with.
Absolutely, and you build the skills. You learn skills in therapy to work with those thoughts and kind of change any irrational thinking into something rational, something that's more manageable. You gain coping tools that you can use for yourself and take home to your partner and show them, or even to your children. A lot of the tools still work for little ones too to help them calm down.
Yeah, absolutely. Is there anything, on this topic that I'm not asking? Anything else you want folks at home to know, when it comes to the things we've talked about?
That it's okay to reach out. That you're not alone. Especially men, it is okay. You don't have to face this alone. And if you have moms and dads in your life that you're seeing are struggling, ask them what you could do to help. It's ask them, how's your day going? How are you feeling? Is a good question to ask. And what can I do to kind of mitigate some of this stress for you? What do you need help with?
Yeah, absolutely. Heather, thank you so much. And again, you're with ThriveWorks in Portage. I want to mention that.
Yep.
Thank you so much for being here and talking about this and, offering those strategies and, working to break down that stigma, I think is so important.
Thank you. Thank you for having me.
We are